Okay, hey there, and thanks for joining us. Like Heather said, this is just an opportunity to answer any general questions that you may have and maybe to talk a little bit more about some of the services that we provide and maybe give an overview of how someone comes in from the beginning and how we collaborate together and develop a plan of action. Let me first let Ashton introduce herself. I do primarily, of course, medication management and supervise or coordinate services with the other providers. And Ashton is more on the clinical counseling end. So I'll let her talk a little bit more about what she does.
Hey everyone, my name is Ashton Araby and I am a provisionally licensed professional counselor. So pretty much what that means is I recently graduated with my master's degree in mental health counseling, and I am working under supervision with a few supervisors, one of those including Dr. Aucoin, to provide, counseling services to a broad range of clients. So I'll be here to kind of talk more about the clinical side of things and maybe figuring out when you would know if it's time to maybe seek help with us, or start receiving counseling services.
So I'll start from the beginning. When we get a call from someone who's interested in services, one of the client concierges will help in deciding which therapist to see. A new service that we're providing is a free consultation. And so if someone is not sure if they want to receive services through our clinic, they can receive a free consultation with Ashton. And she kind of covers a range of areas, asking questions about relationships, how they're functioning with work or with other areas that would possibly be interfered with if there were some symptoms of depression or anxiety or difficulty with focus and attention. So she can give a lot of information about what we do, and maybe even some suggestions about a course of action. So sometimes an individual will come in and they're not sure if they need counseling or medication, if they need an assessment. Again, in that initial session, a plan of action can be developed. One thing that a lot of folks probably aren't aware of is that we can do a psychological evaluation. And that entails testing where we can see if the symptoms that someone may be experiencing are consistent with a certain diagnosis. I think that it's helpful to know if someone does have a diagnosis. For instance, if they do have a diagnosis of ADHD, which is attention deficit hyperactivity disorder, I think it's helpful for them to know that. Or generalized anxiety disorder, where the anxiety that one is experiencing is what we consider significant. And so, I've had people say, well, everyone experiences anxiety from time to time, or everyone experiences a little sadness or depression from time to time. How do I know that what I'm experiencing is considered depression or, is consistent with a certain diagnosis? So the testing that we use is interesting. Usually the individual rates themselves on a variety of areas. And then if possible, we will get someone who's close to that person to complete some rating scales as well. So it's not just your own impression of how you're doing, but also maybe your spouse or a parent or a good friend who will complete some rating scales as well. And then we look at the results of those rating scales and we compare the responses to someone of the same gender. Well, I say someone, actually a large group of individuals of the same gender and similar age group. And then we see, are there clinical or significant differences in those scores? So we're looking at a range that would be considered normal, and we're looking at scores that are outside of the normal range. And that is part of us making a diagnostic conclusion, looking at that data, looking at the presentation of symptoms and deciding, do these symptoms meet or warrant an actual diagnosis, and that would be based on severity of symptoms and such. So if someone is given a diagnosis, I think it's very helpful because then they can run right out to Google and try and find out as much information as possible. I think it's particularly helpful when it's maybe an unusual diagnosis like borderline personality disorder or bipolar disorder, Asperger's, or autism spectrum disorders. So those kinds of diagnoses can be helpful because there's often a wide range of information available online. So I'll let Ashton maybe talk a little bit more about, the development of the treatment plan. So a diagnosis may be given. We always recommend therapy because all of the research that we've seen for, I would say probably most of the diagnoses that we treat show that a combination of therapy and medication are associated with better outcomes. So I'll let Ashton talk a little bit about the therapy process.
Yeah, so I think a main question that a lot of people have is when do I know if therapy is something that would be helpful for me? What is it like? What is the intensity that I should be looking for? Things like that. And I think that a good way to look at it is any kind of mental health condition or emotional concern that's impacting your daily functioning in a negative way. If it's getting to the point where you're no longer able to enjoy things that you usually enjoy, or if your experience of anxiety or depression are inhibiting you from being able to live a fulfilling life, then that's when kind of therapy would be something that you would look into. And therapy would really allow you to learn about what it is that you're feeling, why you might be feeling some of those things, and most importantly, learning coping skills that will be helpful for that. And like Dr. Aucoin said, it has been shown and proven that medication in combination with therapy is, can be beneficial for a lot of people. And medication can help reduce some of those symptoms regarding mental health conditions, things like that. While therapy is able to teach you skills that you can continue to use even outside of the medication realm.
That's a good point, Ashton. And I've come across some really interesting research lately that highlights the importance of therapy. So there's neuroplasticity is the term if you want to Google it. I find it fascinating. But basically, we're finding that even into adulthood, you can change your neural composition. So for years, many people thought that, oh, brain development was pretty much over by like 22 to 25. And yes, in large measure, your prefrontal cortex will be completely developed by 22 to 25. When I say completely, there are some changes that they are seeing now with some of the neural pathways. And so medication can often set the stage. Let's say someone's experiencing really severe symptoms of anxiety or depression and really having a hard time using some of the skills that they've learned in therapy. Medicine can set the stage so that you can actually put some of those strategies in place. And what we're seeing is pre and post scans. These are much more sophisticated brain scans than just an EEG, or I'm sorry, not an EEG, just any of the scans that we would do locally. I want to say that it's I'm going to think of the name of the scan in a little bit, but they're like in states outside of Louisiana where they're much more sophisticated, where you can see the actual neural pathways. But what they've seen is the development of new neural pathways with being able to use skills like that you learn in therapy and creating a new response or a new reaction to stimuli that would have previously caused a different response. So like for some, when they're depressed or anxious, they may recoil and just kind of turn inward. And then that can sometimes manifest in stomach aches or headaches or just really feeling sad and down. And then if they're able to learn other skills where maybe they're better able to be assertive or appropriately address some of their issues by speaking about it more openly, using even deep breathing strategies, then when confronted with a stimulus that would have otherwise led to someone recoiling, they're actually able to put in place these other measures, and we're seeing a new neural pathway that's being developed. So that's what's being seen with the neuroplasticity research.
And I think it could be helpful to identify like a few particular signs that therapy might be helpful for someone. So, number one, if you find yourself feeling overly sad or angry, otherwise, like quote unquote, not yourself, you're noticing these very large changes in your ability to interact with others, and you're just not feeling like yourself. Therapy might be helpful. Also, if you find yourself starting to abuse drugs or alcohol, or any other substance in order to try to cope with something that's going on for you. If you've lost someone or something important to you, therapy could be helpful to allow you to go through that grief process with a trusted professional, someone that would allow you to be able to develop those skills for not only coping with that loss, but also being able to move forward in a healthy way. If something traumatic has happened for you, I know that it can often be scary to, bring those things up and think back on them, on those experiences. Talk to someone that you don't really know yet. But it can be very helpful for people in healing, to be able to process those situations and learn ways of being able to cope with those feelings whenever they come up in the future. Or if you even just broadly find yourself unable to do things that you used to enjoy doing, you're just kind of finding yourself down on life. These are all kind of concrete ways that you can be like, okay, well, am I experiencing that? Maybe, helpful therapy might be helpful for me.
Good points, Ashton. Um, I did find it's SPECT imaging. So just to get back to the type of brain scan that can show the type of neural pathway changes that we were talking about, it's SPECT imaging. So another question that I'd like to address is, how do I know when medication is warranted? So I usually suggest that an individual start off with therapy, unless the symptoms are very severe and debilitating. Therapy is typically very useful and effective, and may not, lead to an additional intervention such as medication. So if after a period of time someone has received therapy and the therapist thinks that the progress being made isn't consistent with what they would like to see, they may suggest that they meet with one of the prescribers to determine if medication is warranted. So again, it would be more looking at the severity of the issues or whether or not other interventions have been tried. With that said, I do have some clients who come to me and they say, I really, I'm not interested in therapy, and, I've been struggling with these issues long enough, and I think I need something that's going to be a little bit more quickly working. And of course, medication doesn't work overnight most of the time. Most of the antidepressants or medications used for anxiety that I use will take about 3 to 4 weeks before you're at a point where you're really seeing full effectiveness. And then we may have to change doses or medications, which brings me to genetics testing. I think that that's probably an area that many people are not fully aware of, or understand fully what we do with genetics testing. We work with a company called Genomind, and we get a saliva sample. Now they're able to mail the kit to your house, and you can mail it back to them. After getting a saliva sample, they analyze the DNA and then send us the results of the report. And then from there, I get information about which medication categories may be best. based on your own individual DNA. So it's personalized medication. It's interesting because there are some variations that would lead to the recommendation of supplements or medical foods. Like for instance, those who have the MTHFR polymorphism can benefit from L-methylfolate, which is basically a medical food or supplement. So that's been very helpful.
And I think overall, it's just important for us to kind of explain all of these different services that we have, because there might be some people that are interested in all of the services that we provide, and then there may be some people that only come for the medication because they're interested in the medication, or there may also be people that are only coming for the therapy. And I think it's important to highlight that there's no single correct approach that works for every single person. And here at Aucoin Associates, we really try to alter and consult with one another and work together to find what is going to be the best approach for each individual client, regardless of what that might be and what that might look like.
Yes, thanks for that, Ashton. I'm wondering if there are any questions.
Yes, I actually have some questions from Instagram. They just weren't able to hop on the call, but they are looking forward to seeing it after. So one of the questions were, how soon should I expect to start seeing signs of feeling better in my sessions if I'm not using medication?
It's a good question. So I think that really depends on each individual person. It depends on how motivated they are to start applying some of these skills that they're learning in therapy. And I mean, it's been shown. So I was able to find some statistics. Let me try to find that really quick. Can't find it. Okay, so there was a study that I came across saying that most people that seek therapy start to feel better within 7 to 10 visits. Now, highlight the word most. Like I said, everybody's different. Everybody has their own, journey towards becoming, healthier, better, feeling better. But I was also able to find that 88% of therapy goers report improvements after just one session. So sometimes it can be helpful for people just to get, start receiving the counseling, the individual therapy, and really identifying. I think it allows them to identify what is it that's really going on for me, and what are some of those ways, like we really start working on goals, identifying what some of those things that they're wanting to work on are in that initial intake, so that from the get-go we're really working on asking what is it that you're wanting to see improve, and then it's up to the counselor and the client working together to get that client to that point.
Great. And then to follow up with that, someone asked, how should I prepare for my first session?
I would say just be open, be honest, be transparent about what you're wanting out of the process. That's speaking for myself, that can be the most encouraging thing, like on my end of things, is when a client comes in and they're able to identify what it is that they're wanting to work on. They're motivated to do what's necessary in order to get there. So I would really say just maybe even thinking beforehand, what are some of those things that you're wanting to see change and be better? And how are you hoping that therapy will be able to help with that?
And there are some medication questions. One of the questions is is medication supposed to be a long-term solution? So if someone's coming in for anxiety or depression and they get put on a medication, is that something that they should expect to be on for life, or kind of just for a few months? How do you guys kind of gauge that?
That's a really good question, Heather. So I suggest that we try to aim for short-term treatment. And when I say that, the research suggests that once someone starts to take medication for anxiety or depression, and once the symptoms are manageable or within what we would consider to be the normal range, then we start the clock. And 6 months after that, we can start to talk about either reducing the dose or looking at making some more dramatic changes like weaning off. However, 1 year of being on medication is associated with better outcomes in terms of not having to reinitiate the medication than if you were to get completely off of the medication after 6 months. So typically, after 1 year, I'll look at the situation and determine whether or not we should try without any medication and wean off slowly. And many of my clients can get off of the medication after 1 year. However, there are some folks who will take medication for longer periods of time. And the rule of thumb is after you have started and stopped medication 4 different times, if you've done that 4 times and still need it, then the rule of thumb is that you would probably need it indefinitely.
And then the final question, which is also has to do with medication, if someone is taken off their medication, what should some of the warning signs be to come back and say, I'm experiencing the anxiety, the depression again? Do you have some signs that you can let people know of to look out?
Yeah, so I'm going to address two things. One is discontinuation symptoms. A lot of people who stop medication abruptly will experience discontinuation symptoms. And I prevent the discontinuation symptoms by helping the client to wean off slowly, and then even if necessary, switching to a liquid product to wean off slowly and to a liquid product with a longer half-life so that we can minimize any of those discontinuation symptoms. So those symptoms are consistent with body aches, just feeling a lot of fatigue. Some people describe it as brain zaps, kind of feeling like a strange, almost electrical sensation. And that is what is associated with stopping abruptly. Now, after someone has appropriately weaned off of medication and they start to see that their anxiety or depression is coming back and getting to the point where it is starting to interfere with their functioning in either their relationships or their academic or occupational functioning, and it's happening more frequently, then they should consider another visit and maybe either some booster sessions with therapy or and or medication reinitiation.